Hi guys, can you hear me? Okay.
Hello.
Hello, so can you hear me?
Evening. Yes, I
Good
can hear you.
evening.
And
Okay, I'm not frozen, right?
no, yeah, not not this time.
Okay. Okay, so now that you can hear me, I wanted us to both be on the call before I share the link with anybody. So we don't need to be going off and on while sharing the link. Okay.
Okay. Okay.
Okay. Okay, so just give me like some minutes so I can share the link and others can join. So I will not just be talking to ourselves.
Okay. No problem. Mm.
Hello, welcome to the person that is online. I'm actually just trying to get a few more people to join before we start. Okay, welcome to those that are on this video call. We are just waiting for a few more persons to join in before we actually start. We already have our guest with us here. So we'll just wait like say like 2-3 minutes before we start. Yeah. Okay, so we'll just get started now. It's already 6:05. Let's not take too much of your time. Good evening, everyone. Trust that day is going on well. It's a rainy Saturday here. I don't know about other regions, right? So yeah, hello to everyone. Thank you all for joining. You can just say hi in the comment section. I would see your comment. So today we'll be talking about ovarian cancer. Sometime last week we did the womb cancer awareness, but today we are going to something different, which is ovarian cancer, still in the cancer awareness series. And this is the month for that. So yeah, that's why we are doing it this that's why we're doing it this month, right? So yeah, so I'll just be giving you a little background of our guest today so that and what you expect to know in this video. Basically, it's just an overview. Let me say overview of what ovarian cancer entails, and you're surely going to learn a lot. By the way, if you're just joining us, please do not forget to like this live video and of course subscribe. Thank you. So let's move into what we have for today. So we have Dr. Umfon Nehemiah here. Is a doctor currently undergoing a postgraduate training in sorry, obstet. You shall know what I want to say. And gynecology. You shall know what is before then,
Mhm.
right? And then he has 7 years experience in medical practice, and a majority of which has been spent attending to the special population of women. And he would be taking us on ovarian cancer today. He studied in the University of Ibadan and finished in 2016, and he presently works in National Hospital Abuja. So yes, so Dr. Nehemiah, you have the floor now. Thank you.
Okay. Good evening, everyone.
Good
Uh,
evening.
uh, Standing on protocols or maintaining what she has said or agreeing what she has said, I'll be talking to us briefly about ovarian cancer. Um, Ovarian cancer is a it's, is a sinister one in that it doesn't have many other cancers have precancerous stages. We have patients have symptoms before it becomes full blown cancer. In many other cancers, they are like the call them forgiving cancers in the sense that they give you a lot of time to intervene because they cause problematic symptoms to the patients. But ovarian cancer is different in that the patients may not experience severe symptoms until it has gone too far, which is why awareness is actually very important. Awareness is very important. Actually, worldwide, it's a problem, and so the community of scientists are still working on getting a proper way to screen and uh, identify ovarian cancer early, so as for prompt intervention. As with many cancers or many other cancers, the key to cure or the key to definitive treatment is actually catching it early. Many cancers are technically curable if they are caught early. If they are caught early. So I will start by talking about how frequent it is. In Nigeria, it is the sixth most common cancer in women, but it's also said to be the second most common genital tract. Like in genital tracts, that is my area. The cervical cancer is number one, and then ovarian cancer is number two in terms of frequency or frequency in Nigeria. The common symptoms or the common age or the commonest age where we will have patients present is usually in their 60s, 50s to 60s. There are different cells in the ovaries. Maybe I should start about that. The ovary, okay, every woman has two ovaries, just like men have two testes. The ovaries are so when they are called or they are located in the ovarian fossa, which is somewhere in posterior parts of the abdomen. I'll try as much as possible not to bore you with too much medical jargon, but the ovaries are in the abdomen, somewhere on the sides of the womb, somewhere on the sides of the uterus. And typically, they are there in a young girl all the way from when she's in her mother's womb. So, as opposed to guys who have their testes producing sperm all the way till their 70s, women, they have their ovaries with a number of eggs all the way from their mother's womb, and it begins to count down. By the time they are reaching puberty, they have about 400,000, but then they ovulate about 400 in their lifetime. Now, this means that every month, the ovaries go through different cellular changes. Every month, some group of eggs, I'll call them eggs, some group of eggs are recruited. They are made to grow. One overtakes the others and gets pushed out. It goes into the womb, and if there's no fertilization, we push it out in menstruation. This happens every month. Now, the problem with having cells go through repeated changes again and again is that at times there might be accidents, or what we call accidents, and those accidents are things that will lead to cancerous conditions. An accident happening, which will now lead me to the risk factors for ovarian cancer. What we call risk factors are things that make a woman have a higher chance. They don't necessarily It doesn't necessarily mean she will have the cancer. It's just a higher chance. So it has been found that the women who have early menarche, that is, they begin to menstruate early, and they have late menopause, so they menstruate for longer periods. So their ovaries go through these changes every month, longer than somebody else who gets pregnant, and during the pregnancy period, ovulation stops. Breastfeeding also interferes with this ovulation too. So ovulation stops. So the ovaries are like giving break. They go on break during the time the woman is pregnant. So women who have higher number of pregnancies or get pregnant early, they are found to have a reduced chance of having the ovarian cancer. Um, Also, women who use combined oral contraceptives, these are pills taken to prevent ovulation. It reduces the number of times the ovaries have to go through that whole cycle of recruitment, one overtaking the other, ovulation. Yes. So other factors that have been implicated in ovarian cancer are well, lifestyle, like obesity, smoking, generally not having a good life. So doing exercises is protective, thought to be protective. Reiterating again, getting pregnant, breastfeeding, having many children is thought to be protective because it reduces the number of times the ovaries go through that cycle. Now, another very very important thing to notice is that ovarian cancer doesn't happen to everyone, or it won't happen to everyone. It's said to have a 1 in 70 women worldwide would have ovarian cancer normally, but then, sorry, 1.7%, not 1 in 70 women. Is it 1.7% chance of any woman around the world having ovarian cancer? But then there is this gene, it's called the BRCA1 and BRCA2 gene, that if any woman inherits or has a mutation in that particular gene, the risk of getting ovarian cancer jumps as high as 40-50%. I don't know if you're familiar with Angelina Jolie, this actress. She had the gene. She lost her mom, her grandmother, and an aunt. And she went to do this genetic testing, and it was found that she had the mutated BRCA1 gene. And because of that, she prophylactically or preemptively, or to prevent it, she took out her breasts, her ovaries, and her tubes. So for now, worldwide, that is the only screening modality I would say. The genetic testing for the BRCA1 and BRCA2 gene, and where it is found that the mutation is present, one can prophylactically or preventively take out the ovaries and know that you have escaped the risk of getting that cancer. The BRCA1 gene is also implicated in breast cancer. So whenever we have patients who have a history of breast cancer, like there's a breast cancer, either you had a breast cancer or you have a family member who has breast cancer, we strongly suggest you go check for that gene. There are women who have breast cancers without necessarily having the gene, but where the gene is present, there's a higher chance that the person will have breast cancer, ovarian cancer, or endometrial womb cancer. Now, still talking about the risk factors. Uh, but I don't know whether we have genetic service testing services here. But if you have a family member, or you know anyone who has a family member who had a history of breast cancer, colorectal cancer, well, separate from breast cancer and uterine cancer, a family history of colorectal cancer, we will strongly suggest you you check yourself for the BRCA1 gene or BRCA1 gene, and where it is identified, you can now begin to take preemptive steps to prevent it. So now going to the symptoms, I started by saying that unlike other cancers, unlike other genital tract cancers, this one is sinister. The organs are in the abdomen, and so by the time they have any changes, they begin to grow, like they just grow quietly, and the woman might not begin. She might just have complaints of, oh, her tummy is paining her, or her tummy is increasing in size, even though that happens a lot later. She might have problems of, okay, she eats and her she eats a little and she gets full quickly, or she finds that she's going to the toilet to urinate quickly. So by that time, the ovaries have grown to the point that they're interfering with the gastrointestinal tract, or they're interfering with urination. At that point, we strongly suggest you have yourself properly checked and not just ignore. Many times people ignore these symptoms, and by the time they're presented to the hospital, it has gone very far. And at that point, we're just doing pele management, or well, palliative management. So once again, if just to recap on what I've said, if there's a family, if somebody wanted, if there's any takeaway from this, if you know anybody in your family, extended family, who has breast cancer or has said to have had a history of ovarian cancer, it strongly suggests that you do the check for the BRCA1 gene. Apart from that, by the time you such a person begins to have complaints of early satiety, as in you eat a little and you get full, or you find yourself going to the toilet frequently, or you're having constipation, like you eat and then you cannot go to the toilet for days. Those are actually the symptoms we can work with for now, because for now there's no other proper screening modality to check for precancerous stages of the ovaries before it becomes full blown cancer. But well, the scientific community is working on it, and hopefully we'll have something to better help that light. Management, usually when it's identified, the surgeons or the gynecologists would open up. Well, they will explain to the woman the condition. They will do some imaging procedures like the CT scan, or actually to see how far it may have gone. More often than not, patients present in the advanced stages because, like I said, it's sinister. So more often than not, we have them presenting by the time it has already gone to other organs, and there's really not much that can be done except to take out what can be taken out and put on chemo. But anyway, what the gynecologist would do for someone who comes with complaints and a CT scan is done, or imaging modalities are done, and it is found out that the organs or the ovaries have gone haywire, is that they will do a surgery where they will open up and look at these ovaries, get the exact staging, and then manage accordingly. If it's caught early enough, very early, it hasn't gone past the ovaries can be taken out, and that is bye bye. That's the end of the story, because it's caught early and you not be worried about it again. But in the case where it has gone far, what can be taken out will be taken out, and then patients will be referred to the oncologist. Those are the cancer doctors who would put her on medications, chemotherapy, usually for the condition. The survival rate or prognosis, once it's caught early, the patient can actually survive for longer than 5 years. But like I said, more often than not, it's caught late, and by the time it is caught, you have to, or the patient will have to undergo, after the surgery, the patient will have to undergo chemotherapy and palliative management. For now, at this time, like I said earlier, for now, at this time, it still remains something sinister and has a high index of suspicion. So, what I would say as a takeaway for our viewers is that if you know any family member, if you know anyone in your extended family, or in your anyone who has someone in your extended family that has breast cancer or ovarian cancer, or has previous treatment for breast cancer, please, you need to keep your head up and keep your eye out. By the time you begin to, by the time the person begins to complain of small, just very, very tiny abdominal complaints here and there, and they seem irrelevant, but then it could be something sinister. So I hope I have blown enough grammar on the situation without causing confusion concerning the topic of ovarian cancer.
Okay. Okay. Yeah. Thank you for that, Dr. Nehemiah. So, basically, yes. So before my village people embarrass me, that word is obstetrics. Yes, I finally got it. I don't know what was happening earlier in
I'm
the
really
video.
sorry,
My
guys.
village people were at work. obstetrics. Nobody's gonna put me to shame. Yes, obstetrics and gynecologist. Yes, I got it. Thank you. Now, okay, so thank you for that, Dr. Nehemiah. I believe the viewers have actually been enlightened. If anyone has questions, they can drop their questions in the chat box. Okay, so from a summary, just like a recap, some of the things I could get from what you said. Some of the things that could trigger, would I say, trigger risk factors of ovarian cancer would be prolonged menstruation, like when someone experiences late menopause, and then also genetic history. So if somebody has family members who have had it before, there's a possibility of them also
Yeah.
getting that as well. So I actually have a question though. I have a question. Um if if someone has genetic if someone has that kind of history, this kind of genetics, and is it okay to, without you having it, or you are at the risk of having it but you don't actually have it, is it okay, or would you say it's wise to actually take out those organs because there's a risk of you having it?
Yes.
Or could there be signs before you just take them out, or could you just take them out based on risk factors?
Okay, for who actually does genetic testing and it is found that they actually have the BRCA1 or BRCA1, BRCA2 gene, it is actually scientific to it has that's I mentioned Angelina Jolie, the actress, this popular actress, she actually did it. Because in her own case, she had her grandmother, her mother, and her mother's sister get
Oh wow.
they died from those cancers, and she now went ahead to now check herself for the gene and found out that the gene she actually had the mutated gene, and that was what actually was responsible for killing her mother and grandmother and her auntie, and so she took it out. So some people actually do what some others do is that they place them on combined oral contraceptives to reduce the amount of times the ovaries have to ovulate. So it's like, and then they will always be going for checkup, obviously. In that kind of case, you know that your eye is
Mhm.
open, like before the ovaries begin to do any funny thing, you're keeping a close watch. I mean, that cannot be done for everybody, or I mean, that might be cumbersome to do for everybody, but in her own case, it's warranted because she saw it kill her mother, she saw it kill her grandmother, she saw it kill her auntie. So she just took it
Mhm.
out, and she knows she doesn't have to worry about that at all again.
Oh,
So
okay.
yes, it's called a risk reducing surgery, and it has been proven to reduce, or well, it's definitely reduce the risk of them coming down with those cancers.
Okay, I see. I'm not sure. I'm trying to check if any question was dropped. I'm not sure if anybody has any questions. Let me see. I'm trying to check the chat. I can't even see any chat, so I'm not
Okay.
exactly sure if anybody has questions. Okay, so if they don't have questions, I guess people will just come and watch it again. Then if you have any questions, they may just drop it on the chat later on in the day. So for now, I think that we can end the video so as not to waste anyone's time. Let everyone go back to what they were doing. Thank you so much for joining us,
Thank
Dr.
you.
Nehemiah.
Thank
We appreciate your
you.
presence here, and we are glad that you're able to join us for this video. So we'll be basically bringing this video to a close. If you missed this video, the replay will be up on my channel in the next few minutes because we are ending the video now. Or if you have any questions, you can drop them in the chat box. So yeah, so we'll be ending this video now, and you
Yeah.
can just go ahead and watch the replay of this video and learn all that you can learn. Thanks to everyone who joined the video, and I'm glad to see everybody. Thank you so much. So we'll see you in another video. Could be a live video, it could be a normal video. And please, if you are just joining, you can like this video and you can subscribe to my channel as well. And you can share the link as well. Thank you. Bye
Thank
bye.
you. Bye.
Bye bye, everyone. So, to the person just joining, you can rewatch the video. Thank you so much for joining. All right. Bye bye. See you.